Welcome to this complete guide on breastfeeding for nursing exams. Exclusive breastfeeding, or EBF, means giving only breast milk for the first 6 months of life with no other food, drink, or even water. The only exceptions are oral rehydration solution, drops, and syrups, such as vitamins or medicines. The breast anatomy includes the alveoli, which are the milk-producing cells, and the ducts, which are the highways that carry milk to the nipple. The lactiferous sinus is where milk collects, and myoepithelial cells contract to eject the milk. Breastfeeding involves two main reflexes. The prolactin reflex, or milk production reflex, is stimulated by suckling and involves the hormone prolactin. The oxytocin reflex, or milk ejection reflex, is triggered by the sight or cry of the baby and involves the hormone oxytocin. Key neonatal reflexes for feeding include the rooting reflex, where the baby turns their head and opens their mouth when touched, helping them find the nipple. The sucking reflex starts when the palate is touched, which is followed by the swallowing reflex. Colostrum, often called liquid gold, is secreted in the first 3 days after birth. It is yellow, thick, and rich in protein, anti-infective factors like IgA, and vitamins A and K. It is low in fat and lactose and acts as a purgative, helping to clear meconium. After colostrum, the milk transitions into mature milk. Foremilk comes at the start of a feed. It is watery, satisfies thirst, and is rich in water, protein, and lactose. Hind milk comes at the end, is thicker, satisfies hunger, and is rich in fat and energy for weight gain. In rapid fire, prolactin is responsible for milk production, while oxytocin handles ejection. The main immunoglobulin in breast milk is IgA, and the caloric value is 66 kcal per 100 milliliters. Here is a comparison between human milk and cow's milk. Advantages for the baby include perfectly balanced nutrients, immunological protection against infections like diarrhea and pneumonia, and promotion of optimal brain development. Psychological benefits include promoting bonding and reducing the risk of long-term diseases like obesity and asthma. For the mother, breastfeeding helps with uterine involution postpartum, reduces the risk of breast and ovarian cancer, and aids in weight loss. Economically, it is cost-effective and can act as a contraceptive through lactational amenorrhea method, or LAM. Regarding the letdown reflex question, the correct answer is oxytocin. Prolactin produces the milk, while oxytocin causes the ejection. Signs of good attachment can be remembered with the mnemonic ALGES, or CMLA. The chin should touch the breast, the mouth must be wide open, the lower lip everted, and more areola should be visible above the mouth than below. Common feeding positions include the cradle hold, which is the most common, cross cradle, good for newborns, football hold, best for C-section mothers or twins, and side lying, best for night feeds. Regardless of the position, the key principle is that the baby's head and body should be in a straight line, facing the breast. Reliable signs that a baby is getting enough milk are passing urine more than 6 to 8 times a day, gaining weight after the initial loss, and sleeping well for 2 to 3 hours after a feed. Unreliable signs include baby crying or sucking on fingers. The best indicators of adequate breastfeeding are urine output and weight gain. Witch's milk in neonates is due to maternal hormone withdrawal. Foremilk satisfies thirst. Exclusive breastfeeding duration is 6 months. Here are standard storage guidelines for breast milk. Expressed breast milk, or EBM, is indicated for working mothers or premature babies. It can be expressed by hand or pump. EBM should be fed using a Katori spoon or paladai instead of a bottle to prevent nipple confusion. Expressed breast milk can be stored at room temperature for 4 hours under typical conditions. Sore or cracked nipples are commonly caused by poor attachment, where the baby sucks only on the nipple. Management includes correcting the latch, applying hind milk after the feed for healing, and air drying the nipples. Avoid using soap or alcohol. Breast engorgement and mastitis are other potential issues. Inverted or flat nipples are diagnosed using the pinch test. Postnatal management includes manual stimulation before feeding, temporary use of a nipple shield, or the syringe method to help pull the nipple out. The most common cause of sore nipples is incorrect attachment, as friction occurs when the baby sucks only on the nipple tip. Absolute maternal contraindications include HIV in developed countries and HTLV 1/2. Temporary contraindications include active untreated tuberculosis, active herpes lesions on the breast, chemotherapy, or severe maternal psychosis. Absolute infant contraindication is galactosemia, which requires a soy-based formula. Other contraindications include phenylketonuria, which allows partial breastfeeding with specialized formula, and maple syrup urine disease. False contraindications mean the mother can still breastfeed. These include maternal fever, cold or flu, hepatitis B if the baby is vaccinated, mastitis, inverted nipples, and pregnancy, also known as tandem nursing. Drugs contraindicated during breastfeeding include anti-cancer drugs, radioactive isotopes, and lithium. Safe drugs include paracetamol, ibuprofen, penicillins, insulin, and thyroxine. The Baby-Friendly Hospital Initiative, launched by WHO and UNICEF, aims to protect, promote, and support breastfeeding. Its core is the 10 steps to successful breastfeeding, emphasizing policies like no free formula samples and early initiation. Key steps of the BFHI include initiating breastfeeding within 1 hour of birth, rooming in, breastfeeding on demand, and avoiding artificial teats or pacifiers. World Breastfeeding Week is celebrated annually from the 1st to the 7th of August. Themes change yearly. The absolute contraindication for infants is galactosemia. Donor human milk is pasteurized using the Holder method at 62.5 degrees Celsius for 30 minutes. The best method to feed EBM is the Katori spoon. Metoclopramide is a galactagogue that increases milk supply. Rooming in is a component of the Baby-Friendly Hospital Initiative, or BFHI. The immunoglobulin predominantly present in breast milk is IgA, which provides mucosal protection against infection. Remember these golden points. Colostrum is rich in IgA. Hind milk is rich in fat. Initiation should be within 1 hour. EBF lasts 6 months. Prolactin controls production and oxytocin controls ejection. And galactosemia is the main contraindication. For quick revision, prolactin is for production, oxytocin for letdown. Foremilk is for thirst, hind milk is for hunger. Good latch is key, and sore nipples are usually a latch issue. Thank you for watching this video. Best of luck with your exams. Here are the sources for the images used throughout this video.